guys ready? Well, good morning, everyone, and welcome here to Nassau University Medical Center in East Meadow here on Long Island. Today we're meeting with some elected officials and some very special people to bring awareness to breast cancer. As you know or don't know, October is Breast Cancer Awareness Month. And as a physician, there's nothing more important for us to do than to try to prevent disease and try to detect disease early. The earlier we find something wrong, the better chances we have of fixing it, correcting it, and getting it back to full health. Breast cancer itself is a horrible disease. It affects many, many women and also men in their lifetime. And if we detect it early enough through easy screening exams and through mammography, we're able to treat these people and have much better outcomes. Today we're going to be showcasing our mammography van. Our mammography van is one of the few three-dimensional vans that are out there available for mammography. It goes to different community functions and civic events and takes mammography of women to look for early detection of cancers. The 3D technology is much more advanced than the two-dimensional types that are out there currently and are able to pick up cancers earlier in an earlier stage, and so we have a better outcome with treatment. This van has been brought, made possible by Senator Campanin through his efforts to fundraise and get us the money and the ability to man and staff this van and get it out to the communities. And so today I have here with us Campanin, the Senator, if you don't mind saying a few words.
Good morning. Thank you. Thank you to the medical professionals who do such a great job, Dr. Politi. It's obviously Breast Cancer Awareness Month. This van has been able to extend mammography to many women in need, and now an even better technology for better detection, less false positives. I also wanted to note that we just had signed into law a requirement that the State Department of Health have a women's health website alone, so that we can publicize visits like vans like this, and we can publicize the fact that we now have mammography as a covered service under the Affordable Care Act, so that if people have insurance, they'll be better able to get the mammography. So congratulations to NUMC for advancing this, and thank you again to all of you who do great work here.
Doctor, just say and spell your name first and your title.
Victor Scarmato, Victorscarmato. I'm the Chairman of Radiology and the Acting Chief Medical Officer here at Nassau University Medical Center. So when I got here 7 years ago, we had this mammography van, and it, like most other vans, had analog equipment, regular old film, that they did the mammograms, and that was still great and good, but digital technology had been out, and I set forth to really upgrade this van from that point. And both with public grants and with private donations, we've managed to make this a state-of-the-art imaging van for mammography in the region. There's no other van in not only Nassau County, but in the New York area that has breast tomosynthesis on it. Because I feel no matter if you're going to go and get your mammogram, you should have it on the highest quality equipment that gives you the best chance to have your cancers detected. Not only that, because we use tomosynthesis, we have less callbacks for patients. Nobody likes to get their screening mammogram done in the community and then need to be called back because something was overlapping tissue, something needed to be pressed out. With tomosynthesis, we get less of that. So I think the patients can be sure that they're getting the highest quality images with this van, the best chance of detection, and really have the least inconvenience of having to come back for extra images. I've been really happy that we send this out into the community. We're the largest provider of mammograms to uninsured patients through the state grant. And I want to thank Mr. Hannon especially for that. Make your doctoring month, make your appointment. And if you're not old enough, ask your mothers, your aunts, girlfriends, wives, whoever. Make sure that people get